Hello, and thank you so much for joining us for this week's Thursday with AARP Wisconsin show. Please note that this show has been pre-recorded, but if you do have any questions or comments, if you're watching us on Facebook.com or YouTube, please still post them below and we will get back to you as soon as possible. Today, we're going to be having some special guests all about falls prevention. But before we get to that, please make sure to check out the AARP Wisconsin website for all upcoming virtual events. We have some coming up regarding voter education, also book clubs, Preparedness Month, as September is National Preparedness Month. So please make sure to check out below. And most of them, you do not need to be a member of AARP, and you could be any age. Secondly, make sure to check out our AARP Community Connections initiative. This was launched earlier this year, where you can call one of our trained AARP volunteers for a friendly voice. This could be daily, weekly, or monthly, but it's just somebody that you could talk to during the day, especially during these isolating times due to the epidemic. So next, I would love to introduce our two guests. And our guest today will be talking all about falls prevention. Hello, we have Mr. Larry White, who is an AARP Wisconsin volunteer. And we also have Carrisa Pagel-Smith, who is with the ADRC of Crosse. Thank you guys so much for joining us today.
Thank you for having us.
Absolutely. Yes, absolutely. So because once again, this is pre-recorded, if you have any questions for any of our guests, please post them and we will make sure to get them answered. So we do know September is Falls Prevention Month, so this really works well with some of the videos that we're doing in partnership with WEHA. But if you guys can tell us a little bit about the La Crosse County Falls Prevention Coalition, how it was started and what is the goal of the initiative?
I would be happy to do that. Because of the fact in Wisconsin, we live longer than most other states. And secondly, we have the worst record for fatal falls among older people. That directed the Wisconsin Institute for Healthy Aging to randomly pick certain counties around the state 11 years ago to introduce two concepts. One is a program called Stepping On. Stepping On was a research project in Australia 20 years ago, where the health department in Australia went into the homes of older people and researched why they fell, where they fell, it's the living room, when they fell, it's usually around noon, and produced a package called Stepping On. It was a 7-week falls prevention course, 2 hours each, taught by a trained medical professional with a peer volunteer. That's old people like moi, and asked us to implement one of those in La Crosse County, as well as starting a falls prevention coalition. So that started, our coalition had its first meeting in February 2010, and we discovered by inviting the right mix of people, and the people included fire department, pharmacists, doctors, EMTs, first responders, social workers, old people, and put them together, and as a group, they discovered and discussed that it takes a whole village to keep old people from falling. So that means they had to work together to find out where our resources, where we know where the old people are, both generations of them. And so then we had to introduce this Stepping On. I'll give you an update. During the last 10 years, we have introduced Stepping On 75 times throughout the county and have offered it to over 700 seniors. It's a 7-week, 2-hour falls prevention thing. And guess what the curriculum is? They fall because they have bad balance. So they have exercises for improving your balance. They fall because their weeks are atrophied and their muscle tone is gone. So they teach you how to strengthen your legs. They discover also that people fall at home because there's all kinds of clutter and stuff, and they tell you how to do that. They also include in the curriculum is a review of all your prescriptions with your doctor and your pharmacist. So the pharmacist can go through all of your drugs, and you may be taking some drugs that cause you to fall. So that's part of the curriculum. And also why you should see a hearing specialist and a vision specialist. That puts you at risk of falling. So that's what we've been doing for the last 10 years, and over 700 people have had that.
Great. Happy 10th anniversary. And I am familiar with the Stepping On program. I'm in Milwaukee, but I had the pleasure of shadowing one of the classes. And I was really impressed with what we learned, how to get in and out of your car properly. And they were also talking about medications. A firefighter was there. And I was just really taken back because I actually think it would benefit anybody at any age. Just trying to prevent falls, on the front end. So what type of activities does the coalition perform to meet its goal?
Well, you can see we had Stepping On. And the next thing we did, we had a lot of conversation with the fire department and the police department and the tri-state ambulance, because they are the 3 units that appear when somebody falls in public. And they discovered that most older people who were not injured, if they were injured, they were taken to the hospital and treated. But if they were just a little shaken, they needed to connect those people who were adamant that the first responders not tell their doctor and not tell their kids. So we came up with a magnet, which was put in every ambulance, every fire department, every tri-state, all the fire, so that when they assist somebody, say, use this and go to our website. After Stepping On, the first major activity is we invented our own website, which is called www.lacrosse Stop Falls. And what we did there is consolidated all the wisdom of all the people around the Falls Prevention Coalition and consolidated it into one place. And all of that is shared with 211. So this is the magnet. 8,000 of them were purchased and distributed among all of the first responders. And Carrisa, you could tell them what we're working on now.
Yeah, so we are working to develop an application or a software program that the fire department can use when responding. So when someone falls within their home, they can then ask the patient if they would be interested in being connected with the ADRC or the Aging and Disability Resource Center. If they agree to that connection, then one of our staff would call them shortly after that incident to then follow up and provide information and falls prevention materials to them, perhaps talk about Stepping On, talk about things that they could do in their home to help prevent those falls going forward. Again, so hopefully we'll be piloting that here in the fall with our local fire department as well as Tri-State. So that's exciting. We've also worked hard to distribute a number of our resource guides. So we provide a resource guide that has a lot of this information that Larry has shared, pretty much follows that Stepping On curriculum as well. So we've provided that to a lot of local providers in town. We are working to actually create a smaller brochure that will then also be funneled to the local providers as well as help drive some upcoming website updates.
One of the best popular features of this resource guide is how to get up from a fall. And that's very helpful, and it will be found also on the website.
Great. It's it seems like it's very helpful, especially to the fire department and the people that are helping, unfortunately, the folks who are falling. So it sounds like the coalition is an important community resource. So how can our listeners and our viewers learn more about this coalition?
Yep, so we would recommend that they check out our website. So again, that's lacrossestopfalls.org. Again, a lot of the information, facts, statistics, resources, typically local resources, but also some national resources like the Wisconsin Institute for Healthy Aging is another great resource. All of that information is located on this website. We also try to do our very best to include upcoming events. So For instance, we would have just had our annual Falls Prevention Awareness Day. That event, unfortunately, due to the pandemic, had been canceled in person. But again, we're trying to provide opportunities for folks to be able to do their own activities within their home, or at least try to connect virtually if that's something that they're interested in. So certainly checking out that website would provide a lot of good information regardless of where you're at in the state. And also it's important to note that while our coalition is locally here in La Crosse County, a lot of counties do have similar coalitions, and it would be best to check out your local ADRC for more information.
Great, thank you. And we know that September is Falls Prevention Month. I know we're going to be closing out on the month very soon. So what advice would you give to individuals to help them prevent falls?
Well, don't stop moving. Don't ever stop moving. We have the new flyer, which is soon to permeate the county, has 15 nifty tips, common sense things for anybody of any age to declutter your house, attend a stepping on class, do all those kinds of things. Contact your local ADRC because they would have information about all the resources and all the schedules of all these exercise classes. Also, talk to your doctor every year at your Medicare annual wellness visit, because we worked with our 2 hospitals, the coalition, and with the medical records company Epic out of Madison, and got them to produce fall prevention information after the annual Medicare wellness visit so people can get take-home information. So read that stuff after you get home from the doctor. And subscribe to the county newsletter. In La Crosse, it's called the La Crosse Senior Life. It's wonderful. It's got all the information you need to know, and all the local phone numbers.
Absolutely. And I also know for Falls Prevention Month, if you've been following the AARP Facebook.com and YouTube page, we every Sunday there are 2 videos that are launched at 10 a.m. and also 6 p.m. That's all about falls prevention. 2 will be posted this Sunday, but if you go back to the back Sundays, you can see all the remaining videos also. And it looks like we have another slide. So this is the consumer page, it looks like, for the Aging and Disability Resource Center, the ADRC. So if you happen to be watching this and you're not from the La Crosse area, the ADRC is statewide, so you can check out this page for additional information on your local ADRC. And as Larry and Carrisa said, there's ample amount of resources and information that you can find on this website. Carrisa, do you have anything else to add?
Yeah, I was just to say the easiest way to find an ADRC too, I'm not really sure exactly what that URL is, but it's findmyadrc.org. So again, findmyadrc.org, and they'll provide all the local information for your local ADRC.
Great. So Larry and Carrisa, I want to thank you so much for joining us today. Any final words for our viewers today?
Yes. Our coalition is a very creative, imaginative group, and they're attacking all facets of a community in assisting older people so they don't fall. Technology is used, and Sunday night, 48 hours ago, our elderly neighbor lady came over to visit, and she looked in our house and asked me, "What's that, like a hockey puck you got on your desk there?" And I said, "That's an Echo Dot." And I introduced her to Alexa. I'm afraid to say it because she's sitting right here. Anyhow, so she said, "What's that big? Why is that such a big deal?" Because I said that's the most prominent instrument that is going to prevent falls in a major way among all older people, rich and poor. And how is that going to be done? Because when she gets out of her chair in the living room, she'll just say, "Alexa, turn on the light," and she will get to her bedroom or bathroom safely. And it's also going to remind her to take her pills at the right time in the right manner. And it's going to remind her what time her doctor appointment is. I said, if she ever had an emergency, she could say, "Alexa, call 911. And on Sunday night, she did it from my house. And 2 seconds later, it says, "This is 911. What is your emergency?" It worked.
That's actually a really good
worked.
tip, Larry, because I am embarrassed to say I'm not that tech savvy, so I do not have one of those. But what a great way to just bring more comfort to the home, that if something does happen and if you fall, that could be a way to get help.
Absolutely. You don't need chains or wristbands and all that kind of stuff. But we had pre-tested this with the local fire departments about 6 months ago from my house. And it's complicated because you need a landline in order for it to work, because a landline is a reverse 911. But more people have cell phones and the technology is more complicated. So you need the Alexa to get the right 911 to the right address. So those are the other kinds of issues we're looking at, and we're bringing all fall prevention into the community by having presentations at the libraries and all that kind of stuff. Last year, since in 10 years, we spoke to over 3,000 older people about falls prevention.
And what's great is, those 3,000 people told each, a couple people. So it really is making an impact in the community. So thank you so much, Larry. And Carrisa, any final comments?
Nope. The only thing I can advocate for further is checking out our website, so lacrossestopfalls.org. And what Larry's talking about with some of those presentations, given the fact that, we are in the middle of virtual opportunities, a lot of our presentations we are trying to tape. And there actually is one right on our website now from the fire department who shows how folks, when you do call for help, how someone is assisted up from a fall and or transported for additional help. So we'll continue to post some of those videos. So perhaps advocating for you to check out our website frequently for more of those resources.
Better place to fall in Wisconsin, better than La Crosse County.
Thank you so much, Larry. We will keep that in mind if we ever have to fall. But if you are viewing this video, and once again, if you're not from the La Crosse area, we still encourage you to visit the video for all the tips and information and education that you can use anywhere throughout the state or throughout the United States. So thank you again, Larry and Carrisa. We really appreciate all that you do, not just for La Crosse, but for our seniors. So thank you so much for joining us today. And join us next week while we talk to two of our 2020 Community Challenge grant winners. We will be talking to the King Drive Business Improvement District out of Milwaukee, and then also the Wild Rivers Habitat for Humanity out of Spooner, Wisconsin. Once again, that's next Thursday, noon Central Time, at our Facebook.com page or our YouTube page. And also remember our upcoming due date for applications for our Small Dollar Big Impact Grant. That will be October 19th, and you can find all the information on how to apply for this small grant for your organization at aarp.org/Wisconsin. And as always, please visit our website for all upcoming virtual events. And we thank you so much for being here with us today. And remember to share this video on your Facebook.com page or YouTube, so then now even more people can get this valuable information. So thank you guys again for joining us, and thank you for joining us, and you be safe.